Morning. My name is Dr. Hillel Mazansky, and I specialize in medical hypnosis, guided imagery, nutrition, and exercise. My website being www.gininc.com. Today's health tip, we are going to discuss pelvic pain. This is seen in majority of females, and very few males have pelvic pain. The pelvis is that part of the area that goes from the belly button or navel toward the pubic bone. And because the female has the uterus and ovaries, etc., more conditions develop in females than males. There are many conditions that can cause pelvic pain, and I will just mention a few of the most common. First of all is irritable bowel syndrome, characterized by lower abdominal pain, bloating and gas, alternating constipation and diarrhea. Appendicitis can cause pelvic pain, as can any condition with the uterus or ovaries. An acute life-threatening emergency is ectopic pregnancy, which gives where the pregnancy is in the fallopian tubes outside the uterus, and sometimes that tube breaks, and it's an acute emergency with bleeding, severe lower abdominal pain, dizziness, etc. During menstruation, females usually before their first child, have menstrual cramps. PMS causes lower abdominal pelvic pain. If there are tumors in the uterus, fibroids, that can cause it. There's also a condition called Mittelschmerz. In the middle of the period, 14 days after the onset of the period, the ovulation takes place, and then the small follicle, the egg, ruptures out of the ovary and is caught up by the fallopian tube. That causes a little bit of fluid to escape into the pelvic area and can cause pain and discomfort. Sexually transmitted diseases can cause a great deal of pelvic pain because that leads to infection in the tubes called salpingitis, and adhesions can form, and that can be painful. Later on in life, there is the uterus tends to drop lower down into the pelvis, or the bladder may drop lower down into the pelvis, and that is a source of pelvic pain. During sexual intercourse, females can feel pain in the pelvis, and that might be primary, or where we find no cause, or secondary if the penis is hitting against a sensitive spot in the cervix or the uterus, then pain develops. The vast majority of patients who have pelvic pain, there is no cause found. They have a complete workup and nothing can be found. And in these cases, it is usually stress, anxiety, tension that causes the female to have this chronic, ongoing pelvic pain without a cause being found. And it is these patients in whom medical hypnotherapy and guided imagery can be of great assistance and help, as can irritable bowel syndrome, menstrual cramps, PMS, postmenopausal symptoms. All these conditions respond to medical hypnosis and guided visualization, nutrition, and exercise. My name is Dr. Hillel Mazansky, and I thank you for watching the video.